Go. So welcome everyone. It's 2:00 and we did this time start recording. I am Jeff Feinman. That's Christina Shambro. We're both here as licensed veterinarians working with pet owners all around the country and really all around the world, trying to get you to treat or work with your pet's bodies instead of working against them with antibiotics and anti-inflammatories, because the body really can heal. And that's what we're here to try and convey to you and answer your questions.
And even better than being able to heal is when you work on the body as an energy system, you can prevent many illnesses. And so you can maintain a level of health. What I like to say is, if you think about, kittens and puppies, they are just crazy energy-wise, right? So you may not be able to maintain that for life, but once they've settled down into maybe 1-year-old, 2-year-old, 3-year-old, they've settled down into a high-level energy, but they're an adult. That level of energy, you should be able to maintain that level of energy for their entire lifetime. And then shortly before the end of their genetically programmed time to go, they may get sick with something. They might die in their sleep. That's wonderful and the best. But they may suddenly get sick with something. Both of my cats have, the last 2 cats I've lost, have very quickly died one of them within 2 hours. She was fine in the morning. I came home in the afternoon and she was within an hour of death. And the other one, he basically walked around the whole house, said goodbye, and then laid down and died in 5 minutes. So that's what we can come to expect. That's what our goal is to have your animals be able to live a long, healthy life with full energy and no aging symptoms, or very few aging symptoms. And the same thing's true for us. Almost everything we say for animals, except maybe the diet, is the same thing that's true for people too.
And that is a great point, though I would qualify that, not that we're not going to have symptoms as we go through life and age, but we're going to be able to use the energetic understanding of balance. And again, we'll talk a little more about that, but to understand the symptoms in the context of the full life of the individual. Yep. And that really is what holistic medicine is all about. And that's, again, something else that, we probably won't have time to talk every day or every time we do this about everything, especially since I see that, for example, Ed has joined and had a question on Facebook that he's now asking, but and that we've got a couple of other people that have joined us. But I would like us to talk a little bit, Christina, about how you can tell if your, say, 2-year-old or 4-year-old or 5-year-old, younger, non-sick pet is really in perfect balance or good balance.
Well, we put together a list. A number of the early homeopaths back in the 1980s realized that there were a number of symptoms, because as a homeopath, we record not just the ill symptoms, but we're asking about your pet in general. Who is this animal that's living with you? Do they like to be warm or cold? Are they cuddly and snuggly? Or are they more independent? And so we had this list of symptoms, and then we would cure them of their illness, their asthma, their itchiness, etc. And then we'd notice that a number of these other symptoms would go away. And those symptoms we then came to realize were early warning signs that the internal balance was out. So these are the early warning signs that clue you that the energy field is out of balance. They don't each mean something negative for a specific disease, They're clues that your animal's not completely healthy. And then at that point, you can start doing something. You could start doing Reiki every day. You could work on changing the diet. You could do some massage, different exercise. And then if that's not working, then you move into working with a practitioner to more deeply heal at that level. So some of these are just amazing. They're things that you've been putting up with forever, right, Jeff?
Yep, and that pretty much is, I think the hallmark of all of our practices. And you already mentioned homeopathy and how homeopathic vets have been able to differentiate the common versus the normal symptoms. But we also have to realize that there are people here that don't really know what homeopathy is all about, or what the early homeopathic vets, and you were one of them, Dr. Chambreau, and that's why I'd like you to talk a little bit about the difference between the H words, holistic and homeopathy and herbal, and are they all the same?
Well, let's first take just a moment to back. We'll do that, but let's take a moment first to realize that these early warning signs, you don't even have to know anything about holistic medicine in order to start using them. You can go to the Academy of Veterinary Homeopathy website, and they have a page of the early warning signs. They're on my website. Are they on yours, Jeff?
They are, yes.
So you can go to any of our websites and look for early warning signs and evaluate your animal right now. It doesn't matter if you know anything about the different modalities or about holistic medicine at all, but you can say, okay, wow, my animal doesn't have any of these. That's really good. Or, whoops, I got a lot of these going on. So then you're going to start exploring, what can I do to make my animal, my cat, dog, horse better? So then you're going to start looking at, well, I've gone to my conventional doctor, and they haven't been able to help the hairball vomiting or the goop in the corner of the eyes. So maybe I need to look somewhere else. So holistic is like an umbrella, the word holistic. It's actually, Jeff, I'm getting an echo. Do you want to go ahead and speak a bit about holistic?
Sure. Actually, I think your echo might be the audio that we just talked about before. If you have a regular headset, you can use that. But yeah, I don't want you to don't mess around with your USB too much yet. Basically, there's a couple of factors that we're looking at, but we are balancing holistic and reductionistic. So holistic is looking at everything. Nowadays, the buzzword is individualized medicine. Well, holistic docs have been practicing individualized medicine for hundreds of years, and the new forms that are coming up now are just a I don't want to say it's an interpretation of them. Let's put it that way. Holistic looks at the individual, starting with, are they healthy? And that is the common versus the normal symptoms that we just alluded to. For example, again, and I know I'm jumping back and forth, and this is part of the problem. If your cat is vomiting once a week or twice a week, hairball or anything, is that normal? When you go to the vet and they say, well, a cat's vomiting, that's just the way it is. Well, I think we're here to tell you cats don't vomit more than a couple times a year. You go to the vet because your cat is drinking a lot. Is that normal or is that common? Well, you go to the vet and they're going to say, well, it's pretty much normal for a cat to drink that amount of water, but it's common but not normal. So going back to holistic, Why is that cat drinking a lot of water? Is it a lifestyle problem? Might there be something in the environment like dry heat or heat in the house, or much more commonly dry cat food, which is probably the biggest incriminating factor for cats that drink too much water? Or is it an energetic problem? So once a lifestyle gets addressed holistically, then we can look at the individual and decide if their balance is off in such a way that maybe we can affect that with homeopathic medicines or other holistic modalities. And do you want to try picking it up from there and see
Sure,
if your
absolutely.
audio is...
So holistic medicine, as we said, is the umbrella. And it's based on the fact that there's an energy field that governs our body, that runs our bodies. So qi, you've heard the word qi with acupuncture and Chinese medicine, prana with Ayurvedic medicine from India. In homeopathy, Hahnemann coined the phrase vital force to refer to that energy field. And these are the ones that govern the body, that we're born with. Each of us and each of our animals is born with a unique energy field. This energy field is uniquely sensitive or susceptible to different triggers. So there definitely are many animals that can be exposed to fleas and don't develop a flea allergy. They scratch a little bit, but that's it. And then other animals, one flea bite and their skin is a mess. That is the energy field causing the problem, trying to rebalance itself. It's been triggered by the flea, so then it creates an immune reaction, causing the itching. But the bottom line is this energetic basis. And that's what holistic medicine is based on. We're looking at what is the energetic uniqueness of your animal that's causing it to behave the way it is, that's causing it to have the symptoms it's having. So if you have different animals with different problems, you'll treat each one separately and differently. So holistic medicine is that approach of looking at the whole animal. So that's an umbrella. Now, hanging under the umbrella are all sorts of different modalities or specific ways that we can use to treat animals. Chinese medicine has multiple parts to it. We call it TCVM, or traditional Chinese veterinary medicine, because it's got acupuncture and laser and moxibustion and Tui Na and Chinese food therapy and even more. We have homeopathy, and there are different versions of homeopathy. We have what we like and use is classical homeopathy, and we'll spend several of these talks speaking about classical homeopathy and the distinctions between that and other uses of homeopathic remedies that aren't as deeply healing as is possible with homeopathy. Then we have chiropractic, which is ways of manipulating the body to get the nervous system function normally, which allows the energy field then to function normally. We have osteopathy, that is amazing things they're doing with osteopathy. They can have did an article in the Integrated Veterinary Care Journal an issue or two ago where grumpy mares, they would go in and simply free up their ovary. So they'd do a rectal palpation and go in and they would move the ovary so it was no longer tied up with fascia and sort of stuck. And once they freed up the ovary, the mare stopped being grumpy. So that's this holistic approach. Now, there are a number of holistic things you can do yourself at home that are 100% safe. And many of them won't even interfere with homeopathic treatment if you're working with a homeopathic veterinarian or practitioner. So one of them is Reiki, which is an pure energy healing method. It's sort of like my dream. Every time I watch Star Wars or Star Trek and they had that little gadget and they would just point it at somebody and they'd get completely better. Well, this is a way where your hands can become that pointer, and you can put your hands on an area that's in pain or is wounded, and it can often heal very quickly. after I had first taken a Reiki class, thinking I wasn't going to be very good at it, I had a cat that a cat had a mat. The whole body was a mat. The head didn't have a mat, but the whole rest of the body. And I was down to the last 3 snips after an hour of clipping. And the cat said, "I'm done." And I said, "No, you're not. I've got to finish. It's only 3 snips." And it nailed me in my hands really badly and bit my cuticle. Normally that'd take a couple of weeks to heal. And I did Reiki on my hands that night, and they were 100% the next day.
Wow, wow.
That convinced me that it was absolutely possible.
And it's funny, and I'm sorry to interrupt, but it's funny you mentioned Reiki, because that was my first experience with energy medicine of any sort. Because as you know, I'm very conventionally oriented, and want to know what's going on and learn everything. And homeopathy for me was never even on the radar. But I guess in the 80s, I developed really bad carpal tunnel, and somehow ended up at a local Reiki master. And 2 treatments later, it was fine.
Wow.
Yeah.
Wonderful.
Yeah. Needless to say, I was in Reiki classes soon thereafter. It's like, wow, I need to learn this.
Well, what we've learned about Reiki animal is it's best not to do it hands-on like this, but rather to sit down and offer Reiki on a regular basis. I would say every day for 10 to 15 minutes. And that way, you may prevent even some of these early warning signs from showing up. That's the joy of finding modalities that you can do on a regular basis. There are some other equally good energy techniques you can learn. They're just not as readily available as Reiki. Some of them may be even more powerful. There's theta healing, reconnective therapy, drawing a blank. Can you think of some of the others?
I don't play on that field, so I'm not a good person to ask. Sorry. I mean, the only energy modality that I use is homeopathy. So.
And Reiki. You've learned Reiki.
Well, that's true. Yeah. But it's, as you know, you can channel the energy almost unintentionally when you've got your hands on the animals.
So there are many ways that you can also use flower essences and acupressure, and healing touch for animals there are classes around the United States. Reiki, you can actually be attuned with on the internet. So those are things that can address the holistic approach. So unfortunately, I don't know if it's because they each start with HO, but people confuse homeopathy and holistic. And I think you're clear here that holistic is the overview, the umbrella, and homeopathy is one form of holistic medicine. So we've now listed multiple forms of holistic medicine, and all of them can be very curative. Jeff and I have found that homeopathy is amazingly curative, even preventing future problems. And when we can really cure an animal, we don't even see these early warning signs appearing. They stay healthy. So the interesting to know, Jeff, how did you get started with homeopathy?
I got started in the 90s, which is after you were already probably doing it for a while, actually by reading a book by one of the homeopathy skeptics, but in one of the chapters were all the references to the old studies of epidemics back in the 1800s and the early 1900s. And I went back, which is my usual MO, is to try and get to the original source. And I went back and read those studies and saw that homeopaths were saving most of the patients, and most of the other patients were dying. We're talking about cholera, plague, Spanish flu. I mean, where's the placebo effect if this is placebo? And then I just started, experimenting on myself and my animals and saw the amazing responses. Actually, my story was that at the beginning of my investigation, I was playing with myself. That sounds pretty bad. I was, sorry. I was experimenting with some homeopathic medicines for an acute problem, but I had inadvertently included the totality of all of my issues. And my shoulder problem went away. And I just figured as a skeptic, well, it would have gone away anyway. But at that point, I had been having lifelong allergies symptoms. And May came and went and no allergy. June came and went, no allergies. July came and went, no allergies. By the fall, I was enrolled in the professional course in homeopathy.
Yeah. That's great. That's wonderful. An example, you were talking about epidemics, and dogs. A number of people realize that vaccines are causing problems with their animals, so they don't want to do vaccines, but they're concerned that, what about Parvo? If their dog is exposed to Parvo, the whole litter is going to die of it. Everybody in the house is going to get it and die of it. And while we said earlier that each animal is unique and has a unique trigger, there are some viruses particularly and some bacteria that are so strong that they will impact a high percentage of people or animals. And so what we've discovered is we can treat Parvo very successfully. And very often we are curing Parvo even without doing Parvo tests. We're catching it at very early diarrhea, but we know they've been exposed. And so we're able to stop dogs from dying from Parvo, just like we did stopping people from dying from Spanish flu.
And that's why, I personally never am concerned about any of the infectious diseases that are around us and seem to be increasing. And again, we'll talk a little bit about that as well. Are things like Lyme and Babesia and Ehrlichia, and are all those diseases really increasing? Or are we becoming more prone to get those diseases so we get sick and they're getting epidemic secondarily? But because of the success of homeopathy in treating infectious diseases, whether it's Lyme, Parvo, distemper, Staphylococcus, yeast, pretty much I personally, and please comment yourself as well, have never ever had a problem with it, really any of those. And I have not seen a single, and I've treated quite a few Parvo cases, but I've never seen a single death from Parvo. Andre Sain talks about pneumonia in his book about epidemics, which will hopefully come out soon, but how the homeopaths would treat patients with pneumonia symptoms and they would just get better and walk away, but other patients were just dying in the hospitals left and right.
Well, I must say, in my 30 years or so of doing homeopathy and of teaching homeopathy, I certainly have seen dogs and have heard of cases of dogs with Parvo who did die with homeopathic treatment. So the challenge is to find the right remedy, and the challenge is often also to be able to treat the dogs before they're getting conventional treatment. Sometimes if they've already had a lot of antibiotics, it may make it more difficult for them. to respond to the homeopathic remedies. And they also may need some what we call conventional treatment of fluids. So sometimes fluids can also be very critically important. Cheryl Ewell, who's a wonderful homeopathic veterinarian in Canada, who was head of the Ontario Veterinary Board for a while, said even before homeopathy, she never lost a Parvo case because she gave such a high quantity of fluids, 10 times what most people were doing. So yeah, to answer Chris's question, I think, Chris, you've seen that Jeff and I both love homeopathy, and we think homeopathy can be very, very effective. I really do feel it's the most curative modality when we can find the right remedy. And so for those of you who, it's like if you guys don't type messages down there, we don't know what you want to hear about. So we know that Chris wanted to hear a little bit about homeopathy, so we're going to, talk more about that. But Lynn and Jordan and Kathy, you may, be really new to this, and you're looking at, well, what are some of the basic things I can do? What are some of the key things I can do? On my website, I have 7 keys to health, and one of it is what we're talking about here is really understanding that there is an energy basis and that you can deeply cure animals, and evaluating where you are now, looking at these early warning signs, quantifying any ill symptoms that your animals have. And another is to feed the best possible diet. And we'll certainly do a whole session or 2 or 3 on feeding better foods, which for Jeff and I both, it's feeding a fresh food diet, using the best quality ingredients, preferably locally, that you can get. It's vaccinating, it's using the fewest toxins, including vaccines, flea chemicals, heartworm prevention, chemical cleaners in your house, pesticides in your yard, etc. And then picking a healing team to work with. So what breed of dogs do you have, Kathy? Kathy says her dogs are naturally reared. So it'll be interesting to see. I know one friend of mine who has naturally reared, I think, border collies, and she was still showing her dogs at age 24.
Wow. Yeah, well, I think the most amazing thing longevity was in dogs that I've heard recently is a client of mine that used to be a Newfoundland breeder. She said her dogs would routinely live to 18.
Yes. Of Newfoundlands?
Yes.
That is awesome.
Yeah.
That is awesome.
Yep. So, yes, Nova's asking about feeding bones.
And so Kathy says her dogs are mutts. So that's good because you don't know what they were fed or how they were treated initially. And that's a good example, like with Brighthaven, a cat shelter out in California that adopts 16 to 18-year-old cats and has given them homes for the rest of their lives, having one lived to be 34 and many of them lived to be 28 to 30. And so these are a wide range of mostly domestic short hairs. So with Kathy's mutts, you don't know how they were treated ahead of time. And so since you've had them, you've been following the natural rearing. And so that is a great demonstration of how long they can live and how healthy they can be. So we have, you want to answer Nova Simpson about bones, Jeff?
We can talk a bit about feeding and bones, but I did have one other question for Kathy. Kathy, they're naturally reared. They have what's called hybrid vigor, which is mutts. Mutts are hybrids instead of being pure breeds. They're a combination of different genes. I'm wondering if you have had any problems with them. Have they had any health challenges, any issues? Have you ever had to go to the vet for a problem, or are you going just for wellness checks periodically? Because that's very important is the periodic wellness checks, and that's something else that hopefully Christine and I will get to talk about, which is changing our mindset from a disease and our being the conventional medical and veterinary mindset from a disease treatment mindset to more of the Oriental Chinese medical model, which is wellness. Our goal should be to keep our patients well, and if they're sick, if they get sick, then we're going to treat them holistically and homeopathically, but we have, in a way, failed at keeping them as healthy as they could be. But back to bones.
Actually, Jeff, before you do bones, I just want to let people know that in China, what Jeff was alluding to there, and in India, centuries ago, doctors were paid to keep the village healthy. And if people got sick, they weren't paid. And if people died, they were kicked out. I mean, died of anything other than old age.
And I'm going to have to use that as an opening. We're getting distracted and going round and round, but I've got to mention before, and you reminded me just now, that going back to when homeopathy was treating the epidemics, before they were successfully treating epidemics, before there was, antibiotics or modern medicine, all of the best MDs were becoming homeopaths because they saw how eminently successful homeopathy is in helping not only treat the patients, but keep them healthy. There's actually some people, Harris Coulter wrote about how the AMA may have partially, if not solely, come into existence to combat homeopathy because they were losing all their best MDs over to homeopathy. And for a while, the AMA actually made it illegal for an MD to associate with a homeopath. Right. So they were really worried that they were going to lose their best people, and actually they have lost some of their best people, but then modern medical and conventional medicine, funded by the drug companies, just came up in popularity. In fact, homeopathy was on its way to becoming the dominant form of medicine until around the 20s, when modern medicine really came into its forefront, maybe a little more than that. Anyway, back to bones and Nova. Oh, sorry. Yes, I get very easily distracted. Too much going on in my head, I think. No, it's not okay, Nova.
There's probably a remedy for that.
Talk to my homeopath. He's working on that. And actually is helping. I mean, and again, we're jumping back, one of the very first effects that I felt from homeopathic treatment was clarity and energy, increasing clarity and increasing energy. So sometimes even before the physical things improve, that will be one of your first improvements. But
bones.
Thank you. No. no, that's the answer.
Yes,
raw bones are good, and you can pretty much use any raw bone, Nova, but cooked bones are no. Cooking basically causes calcium to solidify in such a way that if a dog or a cat eats a raw bone, let's say a chicken bone, they can splinter and hurt them internally. So I would never advocate cooked bones. There is one disadvantage to raw beef marrow bones, but I'd first love to hear what Christina thinks about cooked bones, because I may be...
Here again, from having doing this for years, I have run into a number of people who have fed cooked bones to their dogs. But what we need to think about first from a holistic perspective is, what do the dogs eat in the wild? What do dogs and cats eat in the wild? Do they pull out a match and hold a fire and cook their bones and cook the meat? Do they pull out a knife and carefully get rid of all the bones in the bird? Or are they like an owl and they cough up all the bones and don't digest them? Nope. They have very acid stomachs that digest the bones. Now, the bones they're getting, by and large, are bones that are wrapped. They're getting a bone. In nature, what they're eating is not a bone. They're eating a chicken leg, okay, or a bird wing, a bird body. So it's been wrapped up in muscle tissue and tendons and skin and fur. And then as they're eating it and gnawing it, they're getting the bone along with hooked on meat and muscles and tendons. So they're not just getting bones that they're crunching on. Occasionally they might, but in general, they're getting bones that are hooked together with other stuff. So what we see in conventional veterinary clinics where veterinarians say never feed bones is generally dried out bones that have been left in the trash, bones that have been, the meat's been cooked, we've eaten it off, and there's just a single bone there. That's not a natural diet for a dog. However, if you've just made maybe a bone broth or soup, a chicken soup, and you've got some bones in there and they've been cooked for 2 or 3 hours, those are probably way soft enough. Those aren't going to splinter. Those are probably going to be fine. I've known dogs who've eaten, been in a picnic, and I stopped somebody from handing a chicken leg or a chicken wing to this dog. I said, "Oh, you really shouldn't feed cooked bones." And the owner said, "Dog's 16 years old. He's been eating these forever." So again, what we see are the problems in the veterinary clinics. We don't see the successes. But in general, I say stick with raw bones to be on the safe side. And then there are two things. There's several things you want to think about with bones. One is, are you eating them for the calcium source? If so, then they have to be bones that can actually be eaten, not a bone that they are just gnawing on. So that means it has to be an appropriate size bone. I mean, a friend of ours, Margot Roman, has standard poodles, just like Jeff, and he eats a whole rack of ribs. She'll throw out this big rack, an entire rack of ribs. And her 3 poodles will just tear them apart and rip them. They hold on, each one holds on to an end, and then they can rip them apart together. And they're crunching down on those bones and eating the whole bones. The second thing is the little incisors in front, the little teeny tiny teeth. Those are made to nibble the meat off of the bone. So it's good to feed some big bones that have just a little bit of meat on them so they can and keep those teeth strong, because those teeth are often overlooked even in raw-fed dogs. Number 3, I have found, and we'll see if Jeff has seen this as well, but over the years, I am seeing more dogs being fed big bones relative to their size who are breaking teeth. And I think that's a overall weakness that we're seeing in the animals, just a less health. And Jeff's nodding yes on that one.
That was actually the one I said. There's one place where I would be cautious about the big, even raw bones, and that's it, is the breaking of teeth. And you brought up another common symptom that I would love to hear your input on. How many times have you seen a golden or other dog that always walks around with a tennis ball in his mouth or some other soft toy, and their teeth are all ground down? And the vet says, "Oh, it's from eating a tennis ball." Or I actually had one last week. They were grooming, they were licking, and the vet said, "Oh, the teeth are ground down from licking so much."
Well, I actually think I just recently heard about the tennis balls. Was that at Sweetbriar Conference? I don't know, but I recently heard about that. And they said that the tennis ball, the fiber on it is so rough that these dogs are constantly chewing on it. Again, it's a sign of ill health in the dogs, just like breaking their teeth on a big bone.
Right.
So it is a sign of ill health. However, unless I'm working with people like Kathy who have healthy dogs with no health issues, then I'm going to say stay away from, you can feed a big bone, let them chew all the meat off of it, but as it starts to dry out, take it away and throw it, I don't know. I try to use things and not throw them in the trash. So put them in an area where your dog can't get to it. Bury it where your dog can't get to it. Even if that means collecting them in your trunk for a while and then dumping them somewhere that's safe. And same thing for tennis balls. I would try to avoid tennis balls. And Nova Simpson said that it was a commercial product she was asking about, Jones Natural Chews Roasted Center Bone. And I've seen, like, there's a local farmer who smokes meaty bones and sells them, and they're sort of all dried out and dehydrated. So I actually would have to research that and look at that. Do you know about that one, Jeff?
Yeah, actually, when I very first began recommending chewing on bones and eating bones, it was the smoked bones from something butcher. It was an online source for smoked bones from a local butchery. Nova happens to have smaller dogs, and they're probably not gonna take off chunks the way a pit bull would. Mm-hmm. And that I think would be okay, Nova, if you just let them chew on those bones. But that brings up the question of the exuberant chewer, because and the individual. Number one, there's your 16-year-old poodle that was eating raw bones all of his life and he was fine. Then I have a patient like I had last week that's been to the dentist 3 times for broken teeth because he is an over chewer. I mean, I have a toy basket here in the office that has bones and other things. We have to take it away and not let the dog even near it because he'll sit there and take off pieces of these big, thick bones. And that actually is another clue to the level of health of the individual is, do they have any of these over-the-top behaviors? And I think we may need to devote a whole hour and maybe have one of my holistic trainer clients, or if you know anyone that's a trainer, they can jump on with us so we can talk about the interplay between homeopathy and behavior and these over-the-top behaviors. But
that actually is a really great. I've done several lectures on behavior, homeopathy for behavior problems, and I learned a lot about behavior. When I prepared for those lectures, I realized that I was trying to treat homeopathically many things that were really behavior treatment, not homeopathic treatment. It was not an illness in the energy field. It was an illness of the environment that they were living in and how they were being interacted with. Which, of course, is one of the keys of holistic medicine and specifically of homeopathic medicine. Look at obstacles to cure. What are those things in that?
And look at everything. Look at the whole. I mean, I'm reminded of the story of the homeopathic patient, a dedicated homeopathic patient back in the late 1800s, when there were some great homeopaths. This patient had a really, really, really bad pain in his rear end. And his great homeopath, have you heard this one? His great homeopath would prescribe for him and the pain would go away. But then it would come back. Homeopath would prescribe again, the pain would go away, it would come back. Finally, the patient said, homeopathy doesn't work. So he went to another doc who did a really thorough exam and pulled out the splinter that was there because that was acting as an obstacle to cure. And that's exactly
splinters will be removed by homeopathy. Peggy Fleming had a wonderful case of a splinter. It was a horse that had been lame for 6 months, and she was in the barn treating another horse. This was not a client of hers. And nothing had been helping this horse. It would get better, worse, but it stayed always very lame, too lame to ride. And so the owner asked her to treat. And she said, okay. And she examined the horse and gave silica because it fit all of the characteristics of the horse, the whole horse. She had no idea there was a splinter there. She gave silica. She gave a very high potency. And the horse got into a lot of pain and actually laid down, maybe because the potency was a little bit too high. And so the owner then called a conventional vet and was telling the homeopathic veterinarian that she was killing her horse. And the conventional vet came out and gave an injection of painkiller, which had been given many a time before, no effect to the horse. The next morning at the coronary band, it created an abscess formed, and within an hour, a hunk of wood came out of that abscess from the coronary band, and the paint on it matched the feed room door, reminding the owner that 6 months previously, the horse had knocked in the feed room door with his foot.
That's amazing.
And then he was completely sound after that, and of course, she said it wasn't the homeopathy. But obviously, it was the homeopathy.
It's a fairly common answer for a conventional vet to say, well, it was a misdiagnosis, or it was, finally the antibiotics kicking in, when we know it's the homeopathic medicine that's making all the difference in the world, because you can see a change within moments after a remedy. And that's a myth that I think we should dispel, that people think that homeopathy is, it only works because it's slow acting. And the reality is that you can give a homeopathic medicine, and we give it in the mouth, on the gums and other mucous membranes. You can see it work within seconds, and appreciate the response by the body that started within seconds for up to days, hours, days, months, and long term. But no, it does not need to be slow, and actually the pace of the disease, the course of the disease, and actually even the disease name. We talked a little bit about Parvo. If you've got rapidly progressing Parvo, you're going to see a rapid response by the body to the homeopathic medicine. But if it's a chronic, long-term disease, then yeah, it's going to take the body a longer time to react to the homeopathic treatment.
But then when it does, when we find the right treatment, it's amazing. Sometimes it takes one remedy. Sometimes it takes doing different remedies along the way. There's a wonderful book I like to recommend to people for homeopathy by Ed Buechler. And if you go to my website, which is myhealthyanimals.com, I have a favorite books page and different topics. So if you go to the homeopathic page of favorite books, I've made little comments on the different books. And this one is Homeopathy, What to Expect, 101 Cured Cases. So you can read these cured cases that are amazing, where the homeopathic remedies worked immediately for a congestive heart failure dog who had suddenly presented sudden onset. Therefore, you could expect maybe sudden response, sudden cure. And it lasted for the year until the book was written, the dog was completely healed after 2 doses of a homeopathic remedy. And then we have ones where there were chickens that had bad diarrhea, and they treated the group of chickens, and that brood was completely cured. The next brood, when they first started with any diarrhea, they were cured. After 1 or 2 more broods being treated, they stopped having coccidia diarrhea with these chickens. And they had this very unusual symptom that made them put their head under leaves and peek out under the leaves at the people. And that's one thing we look for with homeopathy, is what's unique about your animal's symptoms compared to others. And the homeopathic veterinarian there was clever enough. I don't think I would have found this. He was clever enough to find that symptom in our index of symptoms, the repertory.
And what rubric did he use for that?
It was in the mental section. It was in the mind section. Gestures, covering their face with their hands, peeking out through their fingers in children.
Wow.
And that perfectly fit what these chickens were doing. And then, so that was how I came up. And one of the remedies was burrito carb. And burrito carb is a very good remedy for poor developing youngsters, which happens when you have coccidia diarrhea, or vice versa. You're poorly developed and therefore you're susceptible to coccidia diarrhea. So that's a book I recommend everybody get, so that they can read about these wonderful cured cases with homeopathy. And also, you can go to our website for the Academy of Veterinary Homeopathy, and we have some cases there as well. Jeff, do you have many cases on yours?
They're scattered all around, and there's almost 20 years worth of cases and experience.
Excellent.
And we need to get them more formalized. All the cases, documented. That part of the problem with acceptance of homeopathy is we don't have a lot of time to publish and document our cases. And I think that's
so one thing that is, if anybody knows of somebody who's so excited about homeopathy for animals that they would like to learn more about it and read more about it and help the cause of homeopathy for animals, wherever you are in the world, you can find a homeopathic veterinarian nearby and start transcribing their cases. We have a curedcases.com that's for all different modalities, and they can be collected there. So if you want to volunteer to do that, almost any homeopathic veterinarian would love it. I know I would, and Jeff would, for sure.
That's for sure, yeah. And I'm sorry, Jackie, about your problem with the firewall, but we will be glad to address any questions in the last few minutes that we have.
That's right, we're down to a few minutes.
We are, I know, time flies. And
blood clots, Jeff.
Say again?
You know what he's talking about in terms of blood clots?
I believe what I remember from Facebook is that his dog had an adrenalectomy, and please, Ed, correct me if I'm wrong. I believe that she had an adrenalectomy for an adrenal tumor and then had a blood clot detected by ultrasound. Thank you. And he was asking about nattokinase as not a homeopathic medicine, Ed, but it's just a non-traditional medicine for breaking up clots. And I don't have any, as I mentioned on Facebook, I don't have any experience with that. Do you, Christine?
I don't, but what I would say is, even though there's been a tumor and there's been surgery done to remove the adrenal glands, so therefore we probably can't get a complete 100% cure, I would think that if you went to a good homeopath, that they would be able to, it's not that they'd be giving a remedy for blood clots, but rather they'd be treating the whole dog with the tendency to blood clots and would prevent the issue of having blood clots. So I would strongly recommend going to a really great homeopathic veterinarian, or if this is a modality that works better for you, to go to one who does really good TCBM. So either of those would have a chance of working with that.
And that was exactly what I was going to say. And, that's why I asked you. And again, I didn't see if you replied yet. I asked you if whether your dog is still in the hospital or not, because we're not treating blood clots, we're treating your dog as an individual. And if your dog is in the hospital still, she's likely getting all kinds of coming home today. Okay, great. Well, today would be a good time to start treating her, or tomorrow. And there are a lot of things that you can be doing at home, and that's actually why my website is called Home Vet, because at home is where you really can start healing your dog the best. So I guess
the first thing I would do is go get attuned to Reiki, find a Reiki class, and start offering Reiki every day. And then, call your closest homeopathic vet or work by phone with a homeopathic vet.
And the first thing, Parvo is great. The first thing I would ask as a homeopath is, she has blood clots, but where and what are the symptoms? We have to look at the entire situation. I should say the entire situation of what's going on right at this moment, because homeopathic medicines are amazing for trauma and post-surgical problems. I think most people are familiar with arnica. Arnica is one of the most famous homeopathic medicines because you could get injured, as Dr. Chambro did when she got bit, and take arnica and you can actually watch it go away. I know one of my friends became a homeopathic patient because she gave arnica to her little child who got a big bump in her face, was developing a bruise, gave the arnica, and actually watched the bruise resorb within minutes. And she was fine by the next day.
And in the few minutes we have, I just want to say more, Ed. The leech therapy is being used a lot now. But the thing is, that's holistic, absolutely, but it's not going to be addressing your whole dog. So you have a dog that produced a tumor, and now we've removed the tumor and removed a gland. So this dog needs a lot more support than just something like leeches to be used for blood clots. It's like, we're hoping that having listened to us today, you're going to shift your thinking from looking for something for blood clots versus looking for, what do I need to do to keep get my dog healthy again in total. So hopefully you can make that distinction. And while there's lots that can be done at home for a dog that's had this much, produced a tumor, had surgery, and is now coming home from surgery, this is the time to be working with a really well-trained holistic veterinarian.
And that is critical. If you're working or you've been working with a surgeon or referral center and board certified specialists in that vein, I strongly, as Christina just advised, strongly advise adding a vet homeopath or well-trained holistic vet to your vet care team, because they're going to give you another perspective. For example, you could add right away, you could go to the store today and start tonight just some grapeseed extract, which is not a homeopathic medicine, but it's a natural herbal grape-derived medicine that actually tonifies or helps the blood vessels as well as the immune system. So again, if you search on that kind of information, if you know somebody that you can talk to about getting that kind of info, you can get started right away and also start addressing homeopathically with a vet homeopath, hopefully sooner than later.
And it is up to each of you to know if the holistic vet you're working with is really, treating the whole animal or is just treating specific symptoms. So you're the one who's going to be able to tell. A lot of veterinarians have learned a little bit about holistic medicine, but not a lot. And also, we will have, it could be, you said you're working with an integrative vet, so it could be that your integrative vet is looking at treating the whole dog, and right now is specifically going to focus with the leeches on the blood clots. But you want to make sure that you're standing for getting the whole dog treated. And making sure that's happening down the line if it's not happening right away. There are a number of places using leeches. Sherman Knapp has the Veterinary Orthopedic Sports Medicine Center near the Baltimore Washington Airport, and people fly in from around the world for surgery for their dogs, orthopedic surgery. And he uses Reiki and acupuncture and other holistic approaches as well. And they have leeches there. That's where I first saw leeches being used in a veterinary clinic.
Well. So let's wrap it up, because again, we want to do this on a regular basis, and I think we need to be respectful of everyone's time. So
in 2 weeks. We'll see us in 2 weeks.
Let's do it 2 weeks from today, again at 2:00. A week from today is Thanksgiving, so we hope everyone has a great Thanksgiving. Do you have any final words that you want to share, Christina?
Well, Ed said, what about any vets around the country? Again, go to my links page. I have a list of all the veterinary organizations, but particularly for your dog, I would say you need to be doing homeopathy. So I'm not currently taking new patients, but Jeff, are you?
No.
So go to theavh.org and look for the certified ones, see if anybody's near you. If not, start calling the ones that do phone consulting. You can do a search on it that says those who do phone consulting.
And again, one of my goals for 2016 is to build up an online support system for people like you if you're not able to find someone that can help further than or more than your integrative vet, where you'll be able to get the support and the help that you need, but only by adding to your vet care team. So your local integrative vet, your referral center, and then all of the other resources that you can avail yourself of. And was there anything you wanted to just say at the end, Christine?
No, that's it. Just, keep on learning about other holistic approaches. Have a wonderful Thanksgiving. Keep some of that turkey before you cook it, and for your dogs to have some nice raw turkey legs and with all the turkey meat on it. And either that or buy an extra turkey.
and I'm going to close also by saying that have a great Thanksgiving. And two things. One is look at life and look at health holistically. And the other is it's all about balance. And we'll talk next time about what I mean a little more about it's all about balance, but I think we talked about the energetic balance a little bit today.
We absolutely did.
Alrighty, so I will end the recording. And Ed just mentioned his vet is in Alabama, but I'm going to stop the recording, but you'll still be able to chat if you have any time to be here. Good. So thanks, everyone. All right.